Welcome to this special edition of In the Loop. I'm Susan Kennedy. Today we're sitting down with Dr. Travis Gayles, our County Public Health Officer, who is leaving us for another job this week. We're going to sit down and talk to Dr. Gayles about his time serving Montgomery County, especially this past 18 months during the COVID-19 pandemic. We want to hear from him about what it's been like and see if he has any words of wisdom for us all here in Montgomery County. Tell us about this new job that you are leaving us for. We're so sad to see you go.
Well, first, thank you for the opportunity to speak with you all, and thank you for the opportunity to serve the residents of Montgomery County. I will be leaving my position to join a company called Gayles Health, who is committed to improving gaps in access to care and pediatric health outcomes through telehealth and other innovative platforms. And I will have the privilege and opportunity to serve as their Chief Health Officer.
Well, congratulations. Well deserved, and I know you will be fantastic.
And attach on the edges. Make sure it's securely over your nose and your mouth to cover both.
Talk a little bit about this pandemic. Do we ever see a time where we may be able to live without COVID, or is this something that we're going to have to be looking at for many years to come?
Well, the expectation is if we can get to a point where our vaccine levels are even higher than where they are right now.
It's already done.
It's already done.
You did a good job.
COVID will become something like the flu that we see every year, that we will likely probably have to get a yearly booster or shot to prevent worse symptoms or bad symptoms. But that hopefully, if we can get everyone up to a higher rate of vaccination, then we can feel comfortable, at least more comfortable, that even if cases pop up throughout society, that won't translate into a significant number of hospitalizations and a significant number of COVID-related fatalities.
And we've done a good job here in Montgomery County, through your leadership. And it's probably been tough because the state had some different ideas on how to approach this pandemic as far as lockdowns. Talk a little bit about how you were able to, stand your ground here in Montgomery County to get us to where we are today.
Well, we've stood our ground based upon science and data and what has been best for our community. The challenge for us in Montgomery County is we make up nearly 20% of the state's population, and we are a very densely populated society. And so we've got to think through all of those different parameters to provide guidance that keeps all of our residents safe. And it's never been about an us versus them in terms of, us versus the governor's office or things like that. It's really looking through the lens of how do we keep our residents safe and what makes most sense for us.
And this is an effort to prevent us from getting to the point where we start to see hospitalizations increase. Certainly, hopefully nowhere close to what we're seeing in other parts of the country. And we don't want to wait for that number to get to a significant point before we take a certain level of action.
And we recognize that at times that has been in conflict with the state policy. We recognize it's been in conflict with many individuals throughout our county.
I own and operate two small businesses. One of them we are trying to close on a deal worth hundreds of thousands of dollars and will bring employment opportunities to the county. But everything is being held up because of fear. Not fear of the Delta variant, but fear that the county will enact policies that are not representative of the risk that is assessed to our community.
But at the end of the day, we've been guided by epidemiologic and surveillance principles, as well as a desire to keep all of our residents safe, recognizing that the policies we put forward speak for all of the 1.1 million folks of Montgomery County, not a specific neighborhood, not a specific demographic group.
And part of your job has been a little unexpected, I think, becoming sort of a crisis communications manager. It's kind of fallen under your description of duties, if you will. And a lot of that involved a lot of backlash.
Dr. Gayles!
Who elected you?
Dr. Gayles!
Who elected you?
How did you handle the criticism, though? There were folks out there who were very critical of some of the decisions that you made. How did you handle it?
Well, again, at the end of the day, our job is to keep folks safe. And we recognize that for some people, the decisions we made did impact them. We recognize that they impacted their businesses and impacted their families. And for others, they took this on as a political rallying cry, which, I can't speak to the motives behind that. And unfortunately, part of the politicization of the public health response is that the public health world has kind of been put in the situation of it's us against businesses, it's us against education, it's us against all these other things, when that couldn't be further from the truth. And so I think the most important thing is that whether we're talking about appointed officials, elected officials, or community leaders, is that we have to have a great discussion about how we balance those priorities. And we're real about when we make certain decisions that may not be in the best interest from a fully health perspective, but factors in economics and those other kinds of things. I think at the end of the day, it's important to talk about that, but we should not put public health as the enemy, if you will, or the obstacle to being able to reopen. As a pediatrician, I liken it to when you walk into the room with a sick child and their family, and you've got a couple of opportunities. You've got to, one, make sure that the patient trusts you and they're not afraid of you. You've also got to convince the parents that you have the child's best interest at heart and you know what you're doing, and be able to create an environment where they feel comfortable that they are being listened to and they are being heard. Because at the end of the day, you've got to be able to have these conversations to ultimately keep the child safe. And similar to that, take that into communicating with the public. There are a lot of unknowns. There's a lot of uncertainties. And the task is to, one, help make people feel that they can trust you. Not that you always have the right answers, because information is changing all of the time, but that you're being upfront, you're being transparent, and sharing the information and when it becomes available to you. And so that's what I've tried to do in terms of patterning my approach to communicating that information to the public, because as you know, throughout the pandemic, there's lots of information coming in, there's policies being changed on a regular basis, and it's important that folks understand that and have access to good information, because we've seen the impact of bad information and misinformation, but make sure they have a good trusted source of information that they can go to get their questions answered.
Yeah, and that was clear with how you took on your role and carried out your duties. It was very clear. One of the things that we saw during the pandemic, which was tough, was the glaring inequities in healthcare here in Montgomery County. What are some concrete steps we've taken or we need to take to ensure that everybody's taken care of?
I think one of the biggest things for Montgomery County that we've tried to do pre-COVID even is to use data to share where those disparities are and those gaps are. I think the perception is that, we are on average a fairly wealthy county. On average, our health status is better than a lot of other places, but that's just it. It's an average. And within averages, you can hide the huge space between the best and the worst in terms of outcomes. And so we've tried to be intentional to highlight those areas. And so I think the biggest thing is we've got to understand that even in the county where those averages are great, we have a lot of tremendous work to do to be able to get the residents who don't enjoy those great outcomes up to a level where everyone else does. And I hope that moving forward in a post-COVID world, we don't miss this opportunity to finally say, yeah, this disparity in heart disease, this disparity in insurance status, they've been around for decades. When are we going to actually examine the root causes and come up with solutions that get to the heart of what's driving them, so that, God forbid, we have another pandemic, or just in general, we're not continuing to see the impact of those for years to come.
One of the things that you mentioned this earlier too, is the science and the data drove the majority of your decisions. As you leave, how can we make sure that we keep that edict here for the person who comes after you? And will you have any role in who this next person will be? Interestingly,
most of the public health officials throughout the country have been pushing for a recognition of how those social determinants of health, including employment status, access to housing, access to food security, drive health outcomes and other things. And I'm hopeful and I'm confident that whoever my predecessor will have a grounding and an understanding of those principles, because I think those fundamentals are what are going to drive us to get those comprehensive solutions, to look at the root causes of those gaps and inequities in health outcomes. I won't have a role, as best as I know, directly in that, but certainly if there are any individuals who are interested in the position or would like to get a better understanding or my perspective on Montgomery County, I'd be happy to provide that guidance. That's very generous of you. And you worked with many officials here, the county executive, the county council. Did you feel supported in your work throughout your time, especially during the pandemic? Yes, I was very fortunate to work in an environment, and I'm sure if you go through and comb through everything, we may not have necessarily agreed on and seen eye to eye on everything, but was fortunate to work in an environment that appreciated and gave me an opportunity and my staff an opportunity to be able to provide guidance through a public health lens that wasn't filtered through other factors. And certainly, as you referenced earlier, there have been some times where we decided to take a different approach from the state, and that hasn't always been popular. And so I applaud the county executive and the county council for supporting that and understanding the value behind those decisions and why we made that particular guidance.
The medical field is a challenging field to get into and a challenging field to work in, and obviously even more so today. What would you say to a young person who is thinking about a career in medicine right now, looking at what we're facing and what's out there as far as the challenges with COVID and future possible pandemics?
Well, I would say what's different, and I'm going to cringe for a second when I think about several decades ago when I decided to go into medicine, a little bit longer than I'd like to remember, is that the practice of medicine isn't just solely delivery of clinical services. Your clinical encounter is shaped and influenced by so many other parameters. You know, thinking about a person's employment status. Do they have food? Do they have stable housing? And so going into medicine these days, you are going to have an understanding and a grounding in how all of those other things impact and influence a person's ability to do what you're asking them to do, their ability to take their medicine, their ability to come to their appointments, their abilities to adhere to the guidelines that you're giving. And so being mindful of that, particularly in a post-COVID world, going into medicine will require an understanding of that. It'll also probably look drastically different. You know, for years we didn't really have platforms that supported telehealth. And in the last 20 months, telehealth is the sexy thing now. And it's been a great way to improve access for many people and leveraging new technology to increase access and connectivity to services.
Last question. When you look back 10 years from now at your time here in Montgomery County, what will be the thing that stands out most to you, and how will you reflect on your time here?
As much as we've spent, unfortunately, a lot of time talking about some of the criticism that has come up and, quite frankly, some of the nastiness in terms of the tone and level that some people have taken it, on the flip side, there have been a lot of tremendous great people to work with and to serve, and that has been a tremendous honor. And I am appreciative of, particularly in a pandemic setting, folks being open to welcoming us basically into their homes and to have those conversations and provide that guidance and to listen to what we've had to say. It's interesting when I have gone to other places and seen places that aren't quite as compliant with public health guidance in terms of, acknowledging physical distancing and wearing face coverings. And when you compare it to what we see here in Montgomery County, and we also, vaccination rates, we're leading the country or at the top in terms of vaccine rates. And I see people still, adhering to the guidance and doing what we've asked them to do without a lot of resistance. And that is driving us to where we are more so than anything I could have said or done or our team could have done. I think the second thing is I have been tremendously blessed to work with a phenomenal staff who have taken on the burden of being quick and nimble and working long hours throughout the last year and a half to get us to a place where we are. So the combination of working with great majority of residents who have put health first and a staff who have been greatly committed to the work that they do has been, at least to this point, the greatest honor of my career.
Well, Dr. Travis Gayles, thank you so much for your time. We will miss you. Congratulations and good luck to you.
Thank you so much.
The great outside.
My new mom and I have a lot in common.
So shiny.
We both love the outdoors.
That's not a flower.
And she knows a lot about wildlife.
A labradoodle.
You don't have to be perfect to be a perfect parent. Thousands of kids in foster care will take you just as you are.